and I work as a head and neck cancer surgeon. Today's discussion is focused on a very important public health issue, and that's obesity. Worldwide obesity has nearly tripled in the last 50 years. It's risen dramatically, especially in the developing nations, where ironically malnutrition is quite common. After the US and China, India ranks third in its incidence. Let's throw some light on this issue through our expert today, Dr. Parveen Bhatia. You are the founding chairman and senior consultant at the Institute of Minimal Access Metabolic and Bariatric Surgery at the Sir Gangaram Hospital. You also hold the position of medical director, Bhatia Global Hospital and Endosurgery Institute. Your surgical expertise in laparoscopic, robotic, and bariatric surgery has been recognized nationally and internationally with several awards and accolades. Welcome, Dr. Bhatia, to the show, and it's indeed a pleasure to have you on the program today.
Thank you, Dr. Tapeswini, for the kind words and including me or inviting me to participate in such a wonderful program which you have been doing for so long. But I have seen that you are spreading so much of awareness about cancer, and thanks for including the topic of obesity also. As all of us know, they are also epidemics.
Correct. Thank you so much for your encouraging words. I'm so happy that you're here with us today. But let's start with a beautiful and a meaningful quote. And it says, your diet is your bank account, and good food choices are a great investment. But then in this crazy world, we are always on the run, trying to meet all deadlines. So meals are whatever is convenient and fast. So is this lifestyle a matter of worry? And how exactly do you define this word lifestyle?
A good idea, good question, I would say that today all of us are racing the race and we do not know the destination even. And our thinking is, as you have seen, that as all of us start aging, then also we realize that health is the best investment.
Absolutely.
Many people invest in cars and houses and whatnot, but our thinking has been right from my childhood days, सर जाए पर सैर ना जाए, हरकत में बरकत है. So what I mean to say that all of us should aim to invest in health, and if we are investing in health for today, then our tomorrow will be better. As you have rightly mentioned, today is the time when both sides, malnutrition are there. Those people who are not getting the food, they are also malnourished, and those people who are having excess of food, excess of fat, they are also malnourished. So we are fighting the malnourishment today throughout the globe. So we should invest in health.
Right. So we often use these words overweight, obesity, morbid obesity. So what does it mean to a common man?
Good. Our thinking is, and the WHO also had classified obesity and they simplified it in last few years only, that it is a disease. Initially, as you had asked also, most of the people used to think that it is a lifestyle. Obesity is a lifestyle. No, it is not a lifestyle only, but it should be counted as a disease. And to quantify the disease, it can be measured in many ways, and one way is called as BMI, body mass index. You cannot manage what you cannot measure. So our thinking is that if your weight divided by height in meter square. Kilogram by meter square is your body mass index. So if the BMI is 25, that is a perfect normal for a normal human being throughout the globe. And if the BMI is ranging between 25 to 30, then you start falling in the category of overweight and obese. And if you go beyond 35, means you are morbidly obese. So our thinking is in broad spectrum, one should always quantify. You cannot change your height, but you can always manage your weight. So if you are conscious about keeping your weight in the designated BMI bracket, then you will not be hitting towards the morbid obesity.
Right. So, through your practice, do you think obesity is a public health issue?
Oh, yes, it is a public health issue and it has been given due importance, but it requires to give more awareness to the people, and which you are beautifully doing it. Can you imagine in 2017, American College of Endocrinologists, they also thought of changing the name of obesity to ABCD. ABCD means adiposity based chronic disease. Adiposity based chronic disease means it is not the weight only. It is associated with so many comorbid conditions. For example, diabetes, hypertension, the sleep apnea, backache, joint pains, PCOD, and so on and so forth. So many comorbidities are associated with it. So that is the reason now we should see the whole perspective. We should not see that that person is just obese. We should see that whether that person is having adiposity associated or adiposity based chronic disease or not.
Okay, great. So, you talked about the BMI, but then how does a common man, associate this terminology of obesity? Can he measure through his waist size or, the arm thickness? Is there a simpler way how they can figure it out?
No, but let's be very straight about it. There cannot be more simple than you're calculating on your mobile phone. So if you know your weight and if you know your height and just write what is my BMI, it will automatically calculate for you that weight in kilograms divided by height in meter square. So that will be the body mass index. But yes, you can always measure, and there are many parameters of measuring the obesity. For example, waist hip ratio and arm circumference. Or basically thoughts are that ultimately all of us should know that in what place, at what place are we and what is the destination where we are supposed to go. What is normal and what is abnormal. So BMI, waist hip ratio, arm circumference and so on and so forth. So many anthropometric measurements are there. So we should be conscious of that.
So, Dr. Bhatia, obesity nowadays has become so apparent in children. What do you think are the probable reasons for it?
I would say that in children, because the culture is changing, we as adults are responsible for it. We should have told our children and we should have given the examples, not even told, but we should have given the examples that ultimately it is a question of energy balance. So if you are eating too much and if you are exercising no exercising at all, then obviously the balance is being tilted. And that ultimately leads to adiposity, that leads to obesity. So our thinking is that right from birth, right from childhood, our parents should educate the children, our schools should educate the children that if you, for example, if you are not conscious about your diet and if you are not conscious about exercising, then the balance will be tilted and you will carry on accumulating fat, and that will become disastrous, or that will have cascade of events later on. So right from the inception, we should be strongly putting that in their mind that ultimately diet is very, very important, exercise is very, very important, and the diet has to be modified in such a way that it is more of proteins rather than more of fats and more of carbs.
So, in fact, as we said, parents are the key here. But do you think maternal health also predicts a child's obesity index?
Absolutely. I would say that ultimately, if I am given the choice, I will educate all the mothers. So once you educate one woman, or once you educate one mother, whole of the family gets educated, and that will ultimately make a lot of impact. So our thinking is maternal health is also very important. As all of us have seen, especially when the uh, around 22, 23 years old females are there, young females are there, and once they have accumulated so much of fat, and then they are going towards the BMI of 35, 40, and so on and so forth. We always insist that please take care of your diet, please take care of your exercise, please take care of your body figure. But if you are not able to control either of these, then you will land in infertility. The chances of infertility are very, very high. That is why we always tell our younger daughters, especially daughters, that shed before you wed. So once you start shedding your weight, then once you marry, then the chances of infertility will not be there. But if the obesity continues, and if you are still able to conceive, then also if you are not taking care of your health, then the chances are the babies will be large for weight, and large birth weight will also automatically lead on to, as you have seen many times, many especially young children come to us and we ask them for how long this obesity has been there. They always say, right from the birth I have been obese, on the plumpier side, on the murky side. So ultimately our thinking is, no, that is not a compliment to be taken today. One should always make sure that our child is not very plump today.
That this childhood obesity would translate even into an adult obesity?
Absolutely, absolutely. It is a matter of habit. I would put it this way, that as I mentioned, that in class 5th, I got this thought going into my brain that sar jai par sair na jai. Means in childhood only I had started doing exercises for at least 1 hour every day. If I was in school, then we were playing basketball, hockey, and football, etc. But now the trend has changed. Now the children play only the video games. So our thinking is, this is the obesity because they are not spending that much of energy on the exercises. This gets accumulated, and that ultimately leads on to the adult obesity, and then leads on to morbid obesity, super morbid obesity later on.
Okay. So, how does industrialization and commercialization impact the state?
As we have put that, for in our days also, we had to work hard to get to the school. We used to cycle to the school, and then we had to spend energies. But today, because of the industrialization, because of every family owning a car, and they have such a easy access to vehicles, that ultimately the children start from their home, reach the school, just walk for a few minutes, and then they are in the class. Throughout the day they are sitting in the class, and in the evening again the same ritual follows. So our thinking is that this industrialization, so much of change has occurred in last 2 or 3 decades, that ultimately this is the culprit. And one second thing is commercialization. As you see in TV ads also, we have seen so many foods of high calorie, junk foods which we call them as. So many junk food are advertised And once they are advertised, children are very, very, I would say, receptive to all these advertisements, and they carry on binging, or they carry on having these kind of products, and ultimately that leads on to obesity.
Right. So the morbidity which you have described a little, so the morbidity and mortality due to obesity, that most of the medical professionals know, since the time of Hippocrates, which has been more than 2,500 years. So can you enumerate what are the short-term and the long-term impacts of this disease state, obesity?
Good. As recently, all of us have seen in COVID era also, the total number of deaths all over the world, all over the globe, if one calculates, it was found out that 74% of the people who had died with COVID infection, they were obese. 74%. Then if you add hypertension, if you add diabetes, 13% more. So what I mean to say, ultimately obesity is a disease. Obesity is a disease which is not to be taken lightly today, because for example, you can imagine if a person is having a 40 BMI, 45 BMI, if his lungs get infection, COVID infection, then he was not able to inspire or expire or have the excellent oxygenation of the body. And that was the reason of following the PO2, and ultimately the patient had died. So many patients were put on ventilators. So our thinking is, even if, for example, in this COVID era, if you have not been able to convince yourself that this is a direct connection between obesity and death, then you will never ever learn. So our thinking is that should go into the minds of the people, that one, the weight, second, the, as I mentioned, adiposity based chronic disease. You have the more propensity to develop diabetes. All of us know India has become the diabetic capital of the world. So many diabetics are there. Similarly, the hypertension, heart disease, cancers, and joint pains, backache, PCOD, so many comorbid conditions are associated with the disease. And can you imagine, people go in for knee transplants, right? They are obese. And once they get the knee transplants done, they think that they will start running, but they are not able to run because the basic factor was obesity. So until and unless you take care of the obesity, you will not be able to do anything for the disease which are associated with it.
Right, right. So you just mentioned about cancer. So which are the cancers which are well related to our body weights?
I would feel that I should have asked this question to you rather than being a cancer expert. But all of us know that obesity has been proven beyond doubt that the chances of getting the breast, cancer endometrium, the pancreas, and so many lymphomas, so many cancers have been associated with the obesity. So ultimately, we should always think that we are not controlling the weight only, but we are controlling the aftermath of obesity also, in the form of as sinister or as the cancers are.
But then, many a times we think that we are doing everything right, eating healthy, good food, and still we are not losing a pound. So, Dr. Bhatia, is there a protocol for a healthy weight loss?
Excellent, excellent. Our thinking is that धुन बदल के देखो. धुन बदल के देखो means all of us justify whatsoever we are taking. But ultimately, once you go to a nutritionist and then you start realizing that we were taking lot of carbohydrates, we were taking lot of fat, but our diet did not have much of protein. The basic requirement of a human being is 1 gram protein per kg body weight. 1 gram protein per kg body weight. And if you are especially vegetarian, then also the protein intake is very, very less, and that ultimately leads on to more of obesity. So our thinking is that once you change your mindset, that today I am not going to take chini, chikanai, chawal, chapati, charpai, chinta, and I will be away from them, then only you will be able to push protein, protein, protein. Once you start taking high protein diet, then only your weight will come down. And then again, harkat mein barkat hai. Start exercising. Make sure that 45 minutes or 10,000 steps or some kind of exercise is a ritual. It should become a religion. It should not be even discussed. It should be so far, one should be so clear. As that I get up at this age also, I get up at 4 a.m., 5 a.m. to 6 a.m. I do weightlifting, and 6:10 to 7 I do the morning walk, and then I go to Bangla Sahib Gurdwara, and so on and so forth. And then throughout the day we are busy. So our thinking is, it is change your mindset. Dhun badal ke dekho, everything will be changed.
In fact, when you lose weight, you feel so light, as if you're floating in the clouds, and you get a great sense of well-being. I think that's the message we should go to all our listeners.
Tapeswini, in this context only, I would just say that many times once I do the bariatric surgery, once the people come to us, and then I ask them, what do you eat? They say, we eat compliments. So once they start losing weight, 5 kg in first week, 3 kgs in next week, 2 kgs in next week, then they start eating compliments, and that keeps them motivated.
Wonderful, wonderful. So, eating to feel good. That's quite a primal human instinct. And then when we are stressed out, we crave for food which is rich in sugar and fat, because that keeps us upbeat. But are there some low energy density diets that we can tell our listeners?
Yeah, sure.
When you are on a weight reduction protocol.
Absolutely. Our thinking is that one should analyze our diet so much, and we should discuss with our nutritionist also, dietitian also, that we are ultimately dependent on protein, protein, protein. For example, if you are vegetarian, then take egg white. Don't take the yellow part of the egg. If you are non-vegetarian, then take the roasted chicken, roasted mutton, but do not take the fried things. So ultimately, small changes, they bring a big change. They ultimately change the mindset. And for example, if you are a vegetarian, then take lot of cheese, milk products, and pulses, so that ultimately more of protein is going within you, rather than more of carbs and more of sugars and more of alcohol. As you have mentioned, if we start taking lot of alcohol, many times many people have that kind of myth that I take only alcohol, I don't take any diet. But alcohol is nira sugar. So if you are taking only sugar, that will get converted into fat, and that will lead on to the fat deposition throughout. So our thinking is, change your mindset.
Right. So one food which is biggest needle mover, and that's the sugar. And it's mind-blowing to see the amount of sugar that which creeps in our diet. So you just mentioned about junk food. How would you really, how would you really define this word so that our youngsters get to know what exactly is this junk food?
No, and it has been widely discussed also, that ultimately, if one is taking high calorie food, high density calorie food, then it is a junk food. For example, if you are taking burger, if you are taking pizza or such kind of things, then it has lot of I would say carbs in it, and lot of fat in it, and that is ultimately converted into the fat in the body. So try not to take these ready-made foods, as simple as that. If you are dependent on ready-made foods, then you should be ready to fall sick, fall ill early in your life, and then suffer throughout. Our thinking is as natural as possible. If you stay and take the natural salads, green salads, if you take fruits, then you are clearly away from that junk food or the high density calorie food, then obviously you will be maintaining a great health, good health throughout your life.
Lovely, lovely. But we talked about sugars, we're talking about junk, but then a lot of people take this excuse saying that we don't eat the sugars that you say, we eat artificial sweeteners. Do you think this is correct? I mean, does it have any adverse health impacts?
Yes, definitely. Definitely, it has adverse effects. And again, we are emphasizing sugar is the ultimate killer. Sugar is the ultimate killer. Even if it is an artificial sweetener, even if it is a sweetener, it is a killer. So one should try to avoid as far as possible.
Over the counter remedies to lose weight. A lot of people opt for it, it's an easy way. But then how effective are they?
Initially, I would say that many people starting taking tablets, and for example, Orlistat and so on and so forth. I will not name the products, but ultimately they realized that if one carries on taking or these kind of drugs or these kind of products, then in the end they start having lot of side effects of these drugs, and these side effects can be of the range of even tendency to suicide. So our thinking is that we should not, without the prescription of a doctor, one should not take the over the counter drugs. One. Second thing is, lot many drugs came. Corporate also promised that this is the miracle drug which has come for obesity and which is going to change the total scenario. But after few years, because of the side effects, because of, for example, constipation, diarrhea, nausea, and so many side effects, they have been withdrawn. So our thinking is now the injectables. All of us know that injectables have come, that you take one injection every week, subcutaneous, and then it will take care of your diabetes, but it will take care of your weight loss also. But again, please do not take these injections or tablets without the prescription of a doctor. If the doctor feels that yes, you will be benefited and for how long this drug has to be given, then only the answer is there. One. Second thing is, even if your doctor has given you this injections or tablets, but it can have only 10 to 15% weight loss, excess weight loss. Whereas with our surgery, for example, if we do sleeve gastrectomy or gastric bypass, then the weight loss is of the order of 70%. So ultimately, we should not think that we are taking the crutches, even if we are able to walk on our own feet, but we are dependent on the crutches, and then we have only 10 to 15% weight loss. And once you will leave the drugs, then it bounces back. So why be dependent on these crutches?
Correct. So you talked about surgery, but who are the patients who should be the ideal candidate who should undergo surgical resection?
Wonderful. The thinking is, as I mentioned in the beginning, that BMI, body mass index, if it is 35 and above, and if it is not having the comorbidities, then, or if the person is having a BMI of 32.5 but lot of comorbidities, diabetes, hypertension, thyroid, heart disease, and so on and so forth, then you fit into the category for surgical correction. And for the surgery, I would say that initially many people used to be afraid of the surgery and not afraid of the disease. Our thinking is that first of all, you and me should make such a statement that today the obesity surgery is as safe as laparoscopic cholecystectomy, as safe as removal of the gallbladder from the patient. So ultimately that and it has been proven beyond doubt in the literature also, the complication rates of obesity surgery is also of 0.05% only. So thinking is that if one is going in for surgery, sleeve gastrectomy or gastric bypass, the complications, the risk is definitely decreased as compared to risk of obesity per se without going in for treatment.
Right, great. So we talked about childhood obesity and adult obesity. So the interventions that we speak in the two age groups, How are they different? Do we also have surgical interventions for children?
Yes. I would put it this way that if the child has attained the skeletal maturity, means the bones have united, then only one should investigate the patient and one should offer the surgical treatment. If we do not evaluate the patient for skeletal maturity, and if we do, for example, sleeve gastrectomy on a child of 13 years or 14 years, then definitely the person or the young child may have some nutritional deficiencies later on, and that may retard his growth. Or so ultimate answer is that in childhood we would not advocate the surgery below 18 years. Once they have attained the skeletal maturity, then definitely one can go in for surgery. And for them, sleeve gastrectomy is the answer, because you are just taking care of the stomach. But whereas there are people who go in for bypass, in bypass we take care of the intestines as well as the stomach. So we are not advocating for the children to go in for bypass. We would advocate, if the child is more than 18 years old, then sleeve gastrectomy. And if the child, if the person, adult person, is having diabetes, uncontrolled diabetes, even if he or she is taking a lot of insulin and that diabetes is not being controlled, then go in for gastric bypass. Or, and if for example patient is having a lot of hiatus hernia, reflux esophagitis, then goes for gastric bypass. Otherwise sleeve gastrectomy is the answer.
Right. So sometimes even after doing all this, to have a sustained weight loss becomes a difficult thing. People find it very difficult to task. How would you comment on this?
Absolutely, motivation. Our thinking is, when the patients come to us in the pre-operative period, in the OPD only, then we always discuss with them that, for example, if you are ready to undergo surgery for your obesity, but please make sure that you are going to exercise afterwards. Please make sure that you will bring some lifestyle changes. You will not take lot of alcohol. If you will do the exercises, you will take high protein diet, you will not take more of carbs and more of fats, then only you will be able to have a sustained weight loss. If for example, if you start cheating the operation, we call this as cheat the operation. So if you start cheating the operation, then there are chances that, for example, if the patient had 150 kg to start with, he or she has come down to 75 kg now. And if you start taking a lot of carbs later on, then you may go in for to become 80 kg, 90 kg, 100 kg, but not to 150 kg, but you will be definitely start gaining weight. So our thinking is, discipline has to be maintained. And in one line, again, as you know that I am famous for one liners, resist the temptation. Resist the temptation. So right from beginning, if you are going in for surgery, please resist the temptation of taking only the proteins, no carbs, no high calorie, high density food, and maintain a good exercise ritual. Then only you will be able to have a sustained weight loss.
Absolutely. Very true, sir. I mean, if I say that there has to be a holistic approach to a weight loss, I don't think I would be anyway incorrect.
Absolutely.
So there are behavioral changes which you want to bring forth, environmental changes, and of course we intervene through pharmacological and surgical aspects. Do you want to comment anything on the statement? Or
Yes, and especially as you know, in Sir Gangaram Hospital and Bhatia Global Hospital, and once we do workshop throughout the world, then also we tell our younger surgeons that see the whole of the patient rather than the whole of the patient. Means that ultimately you have to see the whole perspective, the behavioral changes, as you have rightly pointed out, the psychiatric dependence, disturbances. Basically the person or the patient has to be evaluated in thorough, in the sense that They should be seen by endocrinologist, the psychologist, the nutritionist, the NSS, the cardiologist. Then only, yes, you should go in for surgery. And once you go in for surgery, then your mindset is so important that, and the whole of the family. Can you imagine? Especially young married females also come that I don't want to tell my husband and I want to go in for surgery. I say no. Please involve your family so that we are going to have the best possible results. So best possible results will be when it is a collective collaboration. So when all whole of the family knows that what are we going in for, and then only we will have the best results.
Lovely, lovely, sir. What a wonderful discussion. Thank you so much for all the valuable inputs. Thank you, Dr. Bhatia. But before I part, I have something little for the listeners, and it says, you don't have to eat less, you just have to eat right. Nature is smart. It puts medicine into your food. So remember, eat food as your medicine and not medicine as your food. If you don't find time for your health now, you'll have to find time someday or the other for your ailments. So friends, flip the coin and work towards a healthy lifestyle. Thank you so much, Dr. Bhatia.
Thanks a lot.
To all my listeners, see you next week with another episode. Till then, goodbye.
Thanks, Tapaswini, but I must give you a compliment at this stage only. That you should stop practicing head and neck cancer surgery. You are such a wonderful compere and you take so much of emphasis on creating the awareness. Excellent job you are doing for creating the awareness. Not many people are able to put these questions or have the interview of the people, and then you have a reach of maybe lakhs and lakhs of people. So I think it is an excellent profession which you are going into. Yes, carry on doing head and neck cancer, but this is an excellent service to the mankind.
Thank you, sir. Thank you
God
so
bless you.
much.
God
Thank
bless
you.
you.
So we wind here, sir, and we'll exit out from the gentleman to the season 2 of Dr. Tapeswini's